The lecture today is about aphasias. At the end of this lecture, you should be able to define aphasias. You should be able to know what different types of aphasias are and give examples for each. Aphasia is an impairment of language affecting the production or comprehension of speech and the ability to read or write. Production means articulation, use of muscles, and comprehension of speech means understanding what the meaning behind that speech is. Speech is an expression of thoughts by articulated sound bearing a definite meaning. If this sound or speech is expressed in visual symbols, it is called writing. That is, when something is spoken and you write it down using a pen on a piece of paper and use alphabets, it's called writing. If visual symbols are expressed verbally, it is reading. That is, something is written on a piece of paper and you use your muscles of articulation and produce a sound. It is called reading. This slide shows the lateral aspect of a cerebral hemisphere. On the right side, there is a blue marked area which is called Broca's area. On the left side, there is another marked area which is called the Wernicke's area. And joining these two is a red arc which is called the arcuate fasciculus. The Broca's area is present in the lower part of the motor cortex. It is, according to the Brodmann's classification, area 44 and 45. Wernicke's area is present at the confluence of parietal, occipital, and temporal cortices, and the red arc is the communication link between, which is the arcuate fasciculus, is the communication link between the Wernicke's area and the Broca's area. The fiber tract which communicates between Wernicke's and the Broca's area. This is another slide showing the lateral surface of the cerebral hemisphere. The red colored area is the primary motor cortex. In the primary, according to the Brodmann's classification, it is area 4. Representation of the muscles of the body is there in the primary motor cortex. The representation of the body parts is upside down, the face area being represented in the lower part near the lateral sulcus. In front of the primary motor cortex is the premotor area. Lower part of the premotor area near the lateral sulcus is called the Broca's area. The Broca's area is the place which is involved in control of the muscles of articulation. This area is also called the motor speech area. Damage to this area is going to cause Broca's aphasia. Usually, damage to this area alone does not produce full-blown Broca's aphasia. Rather, nearby motor cortex and the insula are usually also involved in production of Broca's aphasia. Just in front of the face area is the premotor area. According to the Brodmann's classification, it is area 44 and 45, and this is called also called the motor speech area, and it is responsible for articulation, for control of muscles of articulation. Damage to this area is going to cause Broca's aphasia. Damage to this area alone is not sufficient to produce Broca's area. Motor area, nearby motor area, and the insula is usually also involved. Just below the lateral sulcus, the blue area is the primary auditory cortex, and behind the primary auditory cortex is the Wernicke's area. Wernicke's area lies almost at the confluence of the three lobes, parietal, temporal, and the occipital lobe. It is also called the general interpretative area or intelligence area, you can say. Behind that is the angular gyrus, very important damage to this area or abnormal connections in this area are responsible for the condition of dyslexia, which is another form or another type of, shall we say, another type of language disorder. Aphasias are one type of language disorder, and dyslexia is another type of language disorder. Angular gyrus and nearby areas are involved in it. Behind the angular gyrus is the primary visual cortex, area 17. In front of the area 17 is the visual association area 18 and 19. There is a communication between vernix area and the Broca's area. This communicating link is called the arcuate fasciculus. Damage to this arcuate fasciculus is responsible for production of another type of aphasia, which is called the conduction aphasia. So communication between the two areas, vernix and Broca's, is via the arcuate fasciculus. Now, what are the different types of aphasias? Number one is the global aphasia. As the name tells you, global means large widespread area is involved. In this global aphasia, there is widespread damage which involves both the receptive and expressive functions. That is the receiving functions, that is the auditory and the vernix area, and expressive, where articulation of sound is produced, that is the Broca's area. So damage to these two areas means a large amount of area of the cortex is damaged. Usually occurs after a stroke. This patient can produce few recognizable words because such a large area is involved. This patient would be neither able to read nor write. And if the patient is a deaf person and used to communicate in sign language, this patient would lose the ability to communicate in sign language. Next type is Broca's aphasia, also called non-fluent or expressive aphasia. Because this area is associated with articulation of sound, muscles of articulation are involved. Therefore, this patient would have halting and effortful speech, would have difficulty in actually producing the sound. Speech output is very much reduced. The words that the person is able to produce would not be many, would be able to speak a few words, then stop, and then again speak out again. This person understands speech relatively well. He is intelligent. The language interpretative area, that is the vernix area, is okay. Would be able to read. Writing is a little limited because muscles of articulation are involved, and nearby are muscles involved in use of the hand that might be affected. So writing would be maybe limited. Damage is to the Broca's area 44 and 45.
Can you tell us your name?
Mike Caputo.
And Mike, when was your stroke?
I was 7 years ago.
Okay.
And
what did you used to do?
Worked Autodesk, seven sales and worldwide, and very good. Yeah.
Okay. And who are you looking at over there when you turn your head?
That's my wife.
Okay. And why is she helping you to talk?
She's a speech.
So you have trouble with your speech?
Yeah.
And what's that called?
Aphasia.
All right.
Next is vernix aphasia or fluent or receptive aphasia. Here speech production is unaffected. Speech is fluent. Production means the muscles of articulation are working all right because the Broca's area and the motor areas are unaffected. Sentences do not hang together. They do not make sense. Irrelevant words are mixed up, and the type of speech is called jargon speech or It is also called a word salad, mixture of words without any meaning. The patient doesn't grasp the meaning of the speech. Damage is to the vernix area.
Hi, Byron. How are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment and talked with the people for them over there. They're diving for them at the moment. They'll save in the moment. He'll have water very soon for him. With luck for him.
So we're on a cruise and we're about to
We
get to
will
Juneau.
store it right here and they'll save their hands right there for them.
And what were we just doing with the iPad?
Right at the moment they don't show a darn thing.
Next we have the conduction aphasia. Here speech is comprehensible because the vernix area is alright, therefore one can understand speech. Auditory comprehension is there. The speech production, word production is alright because Broca's area is alright. Fluent speech production is there, but because there is damage to the arcuate fasciculus, poor repetition of words is there. The person cannot put words together, finds it a little difficult. Damage is in the arcuate fasciculus. Next is anomic aphasia. In this problem, the person finds it difficult to find names for the things they want to talk about. There is fluent grammatical speech, but full of frustration because the person is unable to find the precise words required to make the other person understand what he wants to say. Patient can understand speech, can write, but finds it difficulty in understanding written language and pictures. And the damaged area is angular gyrus.
Hello, Miss Honesty. Would you tell me what you're having for supper tonight?
I'm having that the big one. When you cook it, you stick it in the oven and cook it up, and it's all the stuff in it. You put the stuff on top. You cut
Oh,
it. You eat
meatloaf.
it. Yeah, meatloaf.
I like meatloaf.
Now there are a few terms of interest. Number one is stuttering. Stuttering is a condition in which one is unable to produce smooth sounds. This is said to be due to overactivity of the cerebral cortex, cerebellum, and the supplementary motor area. This shows that there has to be a good relationship between the cerebral cortex, cerebellum, and the supplementary motor area to produce smooth sound. Then another term is laughter, which is said to be due to stimulation of parts of the supplementary motor area. Dyslexia. This is another language problem and a very important one. This has been identified lately. Dyslexia is difficulty with learning how to decode at word level, to spell and to read accurately and fluently, despite having a normal or even higher than normal intelligence. These children have been identified as the backbenchers in school. They are not doing well in school. But most of these students are now thought to have dyslexia to greater or lesser degree. It is often an inherited abnormality affecting about 5% of the children. It's the commonest of learning disabilities. Generally, it has nothing to do with intelligence. There are other causes present. Now, reading requires a pattern of activity which includes the occipital cortex, which is activated by visual features of letters, the angular gyrus, where print is transcoded into language, and vernix region, area that assesses. There is underactivation of these areas in poor readers. Now, treatment is modified teaching strategies are required. with use of various senses, hearing, vision, and touch. All this improves the reading skills. And it is important that diagnosis of dyslexia should be made as soon as possible in children. Longer you delay, more difficult it is to check this condition or correct this condition.